Hello, everyone. Welcome to day two of the Iowa Ideas In-Depth Week about homelessness. Today's session, we're talking about supporting homeless populations with unique circumstances. My name is Emily Andersen. I am the moderator of this session, and we have some wonderful panelists who are going to be giving us some great information. This session is focusing on kind of various different groups that honestly could, if we had the time, could all have their own individual sessions, I'm sure. But we've got people that represent communities working with various different community groups that have unique circumstances when it comes to homeless services. People like veterans, the elderly, those escaping domestic violence, youth. And so I'm going to let each of our panelists kind of introduce themselves and tell us about their background and which groups they kind of work with and are able to talk about, and then we'll get started with some questions. Karen, do you want to start us off?
Sure. Can you hear me okay?
Yes.
Okay, great. Well, thank you very much for having me. My name is Karen Abendroth. I am with the Iowa City VA. There are several VAs that cover Iowa, but I'm with the Iowa City VA, and we have several programs that help veterans experiencing homelessness. And for some of the homeless programs, it's interesting to know that not all veterans have to be healthcare eligible. So that's something I wanted to share. So thank you.
Awesome, thank you so much. Hope, do you want to jump in?
Hey, I am Hope Metheny, Transitional Housing Programs Director with YSS, and I have been working with homeless youth since 2011.
Awesome, thank you. Bronis?
Hello, my name is Bronis Perteit, and I am the Director of Client Advocacy Services for the Domestic Violence Intervention Program. I have been with this organization for more than 13 years, and we are the domestic service provider for 8 counties in the southeastern region of Iowa, Iowa, Cedar, Washington, Johnson, Henry Lee, Des Moines, and Van Buren counties.
Thank you. And Angie?
Hello, my name is Angie Arthur. I'm Executive Director of Homeward, Iowa. We are the regional homeless planning organization for Polk County. And with that, we help administer federal funds as well as work in partnership to create our community response to homelessness. So while I'm not a direct service provider, I get to work with all the service providers in our community that serve a wide variety of individuals, including the folks mentioned below, as well as elderly folks in our community that are experiencing homelessness.
Awesome, thank you so much. All right, so to get started, let's do kind of just a general question. I'm going to throw this to the group, so whoever wants to jump in. But tell us about kind of what the needs are of the individuals that you serve in your different capacities, and how those needs may differ from general homeless populations.
I'm ready to go. I guess I can start on the first one. One of the populations that I mentioned was folks that are aging into homelessness. We are seeing across the country and a bit of an increase here in the state of Iowa that people sometimes entering homelessness for the first time are getting older. Are older. And so there's those needs that anyone has that's aging. Can folks do their average daily living skills? Are they able to live independently? And so folks that are experiencing homelessness still have those needs, and do they need to move into other types of care in their lives? So those are all things that are being currently experienced by folks that are aging in our communities.
Thank you.
What I can share about domestic violence victims is we know statistically that domestic violence is the leading cause of homelessness for women and children. And many victims, survivors face homelessness when they are attempting to flee from abusive homes, and their experiences are confounded by economic instability, which is often perpetrated by their abusers. And what abusers commonly do is sabotage a victim's economic stability, making victims more vulnerable to homelessness over time.
Yeah, thank you.
So at YSS IHYC in Des Moines, we focus on youth-related services. So our age range is 16 and a half through age 24. And so we really specialize in those unique factors that are just for youth. For instance, signing a lease for the first time and doing a lot of those good tenant skills, because for most of our youth, they have never rent their own place and they just lack the appropriate role model to really teach them how to become a good tenant. And without role modeling behavior, we're not setting them up for success. So that's really our main focus, is those youth-centered services and teaching and training how to be a long time good tenant until they can become a home owner, hopefully.
Yeah, thank you.
I was going to add, I think with the veteran population, our age group ranges. So we have some young adults, early to mid 20s, who also kind of struggles with some of the things that Hope mentioned. And then we have some folks who are in that older bracket that Angie had talked about, like we're needing to assess their level of care and can they live independently, and if so, what are their what do we need to put in there to help them be successful at home? So we have a wide variety with veterans and their needs. A lot of the veterans we work with do have medical issues and are needing like first floor apartments and housing that is accessible for them. So those are some of the needs.
Yeah, definitely. It's definitely worth noting that there's overlap between all of these, right? That there's going to be people that fit into multiple groups, and the needs as far as services among everyone kind of falls to lots of different service providers, I think.
Hey, so Emily, can I add a couple more things that would be helpful for individuals experiencing domestic violence? So I just kind of pinpointed the economic stability. And so some of the needs would be pertaining to job protections and benefits for survivors, fair pay, childcare and tax credits, and one thing that we'll talk about here is just the lack of affordable housing and the things that would aid somebody who is in an abusive situation transitioning into more of a permanent, sustainable housing, or somebody who's sheltered being able to transition out into sustainable housing as well.
Yeah, definitely. Yeah, that leads into one of the topics I wanted to hit on here, is talking about kind of what is I guess how much of the cause of homelessness comes down to just this difficulty in finding housing, and how much of it can actually be related to these individual kind of group problems, whether it's with the veterans or the domestic violence victims or the different groups, kind of how much comes down to the issues that they face being a member of that group, and then how much of it comes to just other general factors that people are running into in their lives.
Truly think that the lack of affordable housing is the leading cause of homelessness. For affordable, accessible housing for our state and across the country. One of the statistics I think is important to understand is that that talks about for every 100 households in your extremely low income household categories that are looking for affordable and accessible places to live, there's only 24 units available. So that's a huge gap that we have in our community, in our communities and across the state. So that's definitely something that has a big impact. And just kind of throw out another statistic is, for example, if you are on disability, your basic payment is $914. So in Polk County and other counties around the state, the average monthly rent for a one bedroom is $889. Well, that doesn't leave you very much to live on for the rest of the month. So just a lot of those things are have an impact, most definitely.
Yeah,
I would
definitely.
say for our county, Johnson County, it's less than a 0.05 vacancy rate of affordable housing units. And the competition between the University of Iowa Hospital, staff and the college makes it that much more challenging for those who are chronically homeless, are low income, may have some things on their background or issues with their credit. They're in competition with this general rental market. And so it makes it very challenging to find housing. And then because of the cost of living that Angie was highlighting for Polk County, to be able to sustain it over time, we have many challenges where we may have resources to help you get into housing. But then when I was talking about the needs for the economic stability, the jobs that you can make, a livable wage, and benefits and childcare and all of the things that help a person be able to find housing, sustain it, or the other contributing factors, there's just a lot of barriers.
Yeah, definitely. When it comes to those barriers, what are some of the things that, with the specific needs that you guys face with the groups that you work with, what are some of the things that are missing as far as care across the state of Iowa with groups that provide these services? And then as well, I think kind of on top of that, what are some of the things that are being done well?
So back up for just a second. With youth, some of the changes are really unique. And I think it's really relatable. We can all remember moving out into our first place, but most of us thankfully had a support system in place. And that's really what our youth lack. They don't have co-signers. They don't have $2,000 saved up for first month's rent and deposit. They don't have someone to call in the middle of the night to really process through with them. What do I do? My electricity just got shut off. And so for that, it's really like youth focused type of things. And of course, there's a lot more flexibility with youth as well. Having a roommate at 18 is a lot more socially acceptable than having a roommate at age 6. Or those kinds of things. Being a single person makes life a lot easier in general as compared to the young parenting people who have a family of 4 or 5, so they need multiple bedrooms, and now you have even more of a wage gap. The wage gap doubles for the amount of people who are living in your home. You need to make twice as much, and that rapidly goes up. But youth are really coming in at entry level jobs, not much above minimum wage, and it's just not livable.
Yeah, that makes sense. So I was going to share that one of the barriers that we run into often is that the background of some of the folks we try to house, there's quite a few barriers with their background, whether it be credit history or lack of rental history or legal histories, and credit history. Like there's all sorts of barriers sometimes. So one of the things we definitely are always kind of looking for is those second chance landlords or third chance landlords that are willing to kind of give somebody a new shot. So, we've started definitely compiling a list and working with those landlords who are willing to do that. I think the VA is very blessed. They recognize that healthcare, part of healthcare is housing. So we have a lot of programs that will work with landlords and provide financial benefits to landlords, whether it be through the rapid rehousing program or through the permanent supportive housing program that we call HUD-VASH. We definitely like to work with those landlords.
Thank you. Yeah.
What I want to add is Well, one of the things that I feel like we're doing well on, or I can speak for my region, is partnerships and collaborations. Because of the needs, we serve 8 counties. A lot of it is rural, some is a little bit more urban. We rely heavily on our partnerships and being able to, bring our resources together to make sure that we reduce the amount of people that are falling between the gaps. So I think we do that really well. One of the things that we're seeing is resources are drying up. There's just not enough. Coming out of COVID, the increased need for services, with limited resources. I can say through COVID, we had an influx of additional funding, but we've gone back to our pre-pandemic levels of federal and state funding, but we have significantly increased in the request. And we're having challenges, and our partners that we work with are also in a similar place. So I can say recently, within the last 2 weeks, there have been several programs who either have run out of their money for the fiscal year and are no longer able to provide a service, whether that be like security deposit assistance, or if it was a shelter, reducing their stay, which then it also puts additional pressure on those who are providing those services to find ways to do more. So I just wanted to add that piece.
Yeah, definitely.
I agree 100% with what Rhoda said, in the fact that, we have folks that are doing the hard work day in and day out of serving folks with high needs in our community. And I would say, and we can talk about data and things like that, but we've seen a definite increase in barriers that folks are experiencing after the pandemic, through and after the pandemic. But the lack of resources for us to be able to move forward. We've done a study locally in Polk County, and it's helped us identify specifically what resources are lacking. But that comes with the need for investment in the community, as well as local governments, I'd say state government as well, and philanthropy, local employers. It's like a community response that will be needed to make up those gaps. We have, according to the study, an annual gap of almost $20 million that we would need to be able to bring up to the optimal system, right? We know we can make a difference when we have the appropriate level of resources. We'd like to highlight the VA has done a great job in putting some of those resources in place for them. So as a community, Polk County's been what they say a functional zero in homelessness for veterans since 2016. Doesn't mean we don't experience veterans that are homeless, but we have enough resources in our community to meet the needs of the veterans that are experiencing homelessness in the way that they need to be met, so that we can make homelessness brief, rare, and one time. So that's, I think, we know we can do it, right? But we need those resources in our communities to be able to make that difference. And I would say that goes across the board, across the whole state. I will defer to my experts in the other parts of the state, but I would guess it's not different for them as well.
Yeah, absolutely.
I would say some of the largest successes are those individual staff that each of our organizations have, who do all the hard work day in and day out every day, of going around job searching and application filling out with any participants, no matter the program, providing resources and just being their number one support. I think that's really the key to anything, is having the right staff in the right position. And when you have that, it makes all of the difference. Participants become engaged in the process when they're matched with the right person. And that is really what we all are striving to see, is people being matched and people having a community of support, which is a variety of information. I think all of us are doing better at knowing everybody has co-occurring issues for the most part, and really saying, okay, we're housing first. So we've got you in a home. So what else do we need to do to keep you long-term stably housed? Do we need to connect you with mental health services or substance abuse services? make monthly budgets. And really, our frontline staff are doing a phenomenal job of doing all of that every day.
Absolutely.
Yes.
Yeah, definitely.
Sorry about that. One thing I really wish we could do for our frontline staff and the folks doing the work is to be able to pay them better and pay them what they're worth and for what they're doing. I think that's just a general challenge as well for us in our communities, that we're asking folks to do really, really hard work and need to reimburse them in a better way. But it's hard for us, right? Because of limited funding and things like that. It builds on each other, but that's definitely a need.
I would say on our end as an organization, we've had to take some time and we just went through a major strategic plan and look at all of the things. And so, Angie, when you're talking about the livable wage and how do we take care of the staff that are on the front line doing the work, and what are the innovative ways that, we find the money, find the resources, what is our why, how do we tell our story? And then who are the ones that support us in unique ways, finding a way in all of our communities to sell our story and find, how you can meet common ground to create an avenue to continue to build and diversify our funding as well. Because, when all of your funding comes from one source or resource, and say that's eliminated because of our legislation at the time, then it has the ability to eliminate you being able to do what you do best with the people that do the work. So we're in the thick of that. I'm sure all of you are, and looking at ways to expand and increase when we have legitimate limitations.
Absolutely. I think something worth talking about with that funding factor and kind of the limitations that we have is, what are the differences between, I guess, the different populations that you serve? Are there populations that are being served better? Angie, you mentioned that in Polk County, veterans are almost completely housed. And so what's the difference between, I guess, those populations, those veterans there that have the services they need and those that don't? And why are there kind of those differences between the different vulnerable populations you work with?
Okay, well, I'll go for this one if that's okay. If someone else wants to start, they can. I think it's resources, right? And where the source of funding. So there's been a definite push on the federal level to increase the amount of resources available to veterans, which is well needed and important that we have. There's also, when we work with our annual funding program, there's also like a domestic violence bonus. So that we'd be able to focus on that. And there's been, we received a grant for youth and young adults a few years ago. So there's different areas of focus, particularly on the federal level. So I think there's just a need for that overall increase in funding in general from a federal perspective, also local perspective. In the state of Iowa, 5% of the real estate transfer tax is what's used to fund the Shelter Assistance Fund, which is important that we have in our state. Equates to last year in 2023 of $1.3 million for the entire state. So it's important dollars that we have, but when you look at the need, it's not meeting the need that we have. And then one comment too about the Shelter Assistance Fund, again, important and we need it, but it's funding crisis response and not long-term housing stability. So we have to think about those things from those perspectives. So it has to do with sources of funding, what's been a priority in legislatures and federal government, and also, priority in local communities, or is there a foundation that's available in your community that really wants to focus on families and children, whatever it might be. Those are some of the reasons. I'm sure there's others that folks have here too.
Yeah. Karen, you look like you were gonna jump in.
Yeah, I was just going to share, yes, the VA, like I said, is definitely one of the priorities for National VA is housing veterans. So it's on their radar, and a lot of benefits are given to veterans who experience homelessness in regards to across the state of Iowa, there's 473 supportive housing, those HUD-VASH vouchers I was talking about. So the funding is there. And then we've got, especially all of our northern counties, even the rural ones, we have SSVF, which is that rapid rehousing. SSVF stands for Supportive Services for Veterans Families. So over the years since 2010, when the VA really kind of took this challenge to end veteran homelessness on, there's been a lot of progress. They do a lot of surveys amongst all of the veterans and families and stockholders, basically, and kind of see where the gaps are. And they've added programs on over the years. And I just wanted to add to that Scott County, which is part of the Quad Cities, and Rock Island County also have got their declaration that they've ended veteran homelessness. Again, like you said, Angie, it's not that they're not homeless. It's just that, you know, they're identified quickly. There's a system in place to get them housed quickly, and goal is to make it rare. So a rare occurrence. So
I think the VA has been really a leader in a lot of the programs that maybe started with the VA and have moved over to other parts of the system. So they think that innovation is very helpful. And they've also been able to realize that permanent housing is really great, but also you need those supportive services to wrap around it. That housing first has been very successful in long-term. I want to say, and please correct me if I'm wrong, Karen, that like since 2011, about 55% of the homeless veterans have been housed, and it's been really focused with housing first. And that's like an important goal, right? That's been met and shows what can be successful.
Thank you. We've received several audience questions in the chat here. I've kind of been looking through, but I'll have to, let's see. This one looks interesting, kind of related to what we were talking to. It says, it seems like legislators and community leaders think that everything is being taken care of, but do not understand the challenges. How can we improve awareness to those that hold the purse strings or the gatekeepers of information disbursement? Any thoughts on that? Just getting the word out there, I guess, to those that can make those changes.
I'll just kind of jump in. One of the things that I would say is I think the statistics are very important. And that's definitely one of the things the VA uses. And I know yesterday on the call, they were talking about the point in time count. And that is like where people in the community, I'm sure all, you know, most of us on the phone or on the call here have been one of the volunteers for the point in time count. And it's basically identifying who is literally homeless and where are they, and getting those statistics and getting people into the system of coordinated entry, which is a system that we all kind of work together, all of the community partners, so that we have a good idea of how many people are literally homeless, and then sharing that data. So I don't know, that's what I was going to add.
Yeah, I was going to say share it with all key stakeholders, you know, policymakers, board of supervisors, city council, anybody and everybody, to get the word out, but also knowing your audience so that you can, I don't want to say craft the message, but that you get that particular stakeholder the information that they need, so that then when you do that ask, they know how they can make a difference. What information do they need to have to then carry it to the people that they work alongside is so key.
Yeah.
Yes, sometimes there's we have to really tailor what we're talking to awareness and education. With some of our funding sources, we're not allowed to lobby. So of course, people as individuals can always contact their senator or local representative. But some of those as nonprofit organizations, we are limited at times on what we can't lobby, but
I do think, though, there's an opportunity for education and advocacy. Lobbying is very specific. You have to be talking about to a specific legislator about a specific bill and asking them specifically to do something, right? But you can reach out to your elected officials and invite them to where your organization is. Show them what you're doing, how it's working. Tell them about the challenges of a funding perspective. Tell them about the good stuff that you're doing. Celebrate your wins, right? So there is a difference. And I think we sometimes get carried away with that concept of, oh, this is lobbying. No, you're advocating and you're educating folks. And that is really, really important. So I do think that is that communication. It is, if you've got leadership of organization, again, building on what other people have said, reaching out to your supervisors, having that conversation, reaching out to your local city councils that you're at, talking about those different things, meeting with faith-based groups if that's of interest.
Absolutely.
Meeting with different organizations that might be beneficial in your community to just really share the message. It has to be intentional. And I think it's important for us to remove the myths and the incorrect assumptions about homelessness and what's happening and why and the needs, and just let people know about the need for affordable housing and how it affects us all.
Yeah.
What I can add to that particular piece has been helpful for us. A lot of organizations are working off of, a small number of staff that are doing multiple jobs. One person is doing the equivalent of 3 or 4 full-time positions and having the ability to do the work on the front line that then, allows you to continue to exist as an organization. But we had to have specific people assigned to the community engagement side so that in all of the communities that we serve, identifying who the key stakeholders are, building the relationship over time in an intentional way. And I think it was mentioned here before, then knowing what matters to those groups and how to adjust what our needs are, or how we're communicating that to them and getting them the information, which then creates buy-in, even if it's not their particular issue or need, to try to get more support from all of the communities, an investment in knowing what matters to them. So it may be one of our counties where if they give a donation or Board of Supervisors is supporting, they want to make sure that their resources are staying locally so that it can help their residents, and being able to work with that. I would just add that is been key on our end, and being more intentional about who we're going after and how we're building those relationships, and then how we're selling and letting them know what we've got going on and why the need is so great.
Yeah, absolutely.
Yes. Education and breaking down stereotypes is probably 2 of our biggest things. A lot of people have grown up with stereotypes in their head of homelessness, and we are here to really educate on what is really happening, especially in our economy that we're facing today, and the lack of affordable housing and how it all ties together.
Yeah. I think related to that, we have this question here. Similar to community outreach, this person's wondering a bit more about community outreach with the populations that you're serving. It says, are there certain populations that are not being connected with the resources available to them? And what can we do on the front lines to make sure those people are being connected?
So there's a lack of connection when we go to any of our rural communities. Des Moines obviously is very fortunate to be urban. So we have like a youth drop-in center where youth can come to us. However, when we're talking about rural homelessness, that looks vastly different. And we can't just have an outreach center in the middle of a cornfield. So it takes a lot more time and a lot more money to get the same mission done. One of a demonstration project that we did, it said that it cost about 3 times as much to serve the same number of youth in a rural community by the time you put in staff time, transportation, all of those variables, as compared to having one centralized location. And so that's really hard to do when we're talking about, a very small town or community.
Yeah.
From an outreach perspective, there's staff not only in the metropolitan area in Polk County, but there's others around the state, however, but very limited from that perspective, that do try to connect with folks that are living in shelter. And what that, some of it's basic needs to make sure that, but it's also important that there's a conversation about housing and what can we do? Is it, you don't have an ID and that's your barrier and you need to get a security card? Like some of those things that seem simple take weeks, if not months, to complete. And so that also has some of that impact. I would say locally, reach out to what service providers are in your area that might be providing resources. See if there's ways that you can volunteer. If you identify a person that you think might be experiencing homelessness, I help look at what kind of resources are in your community. If there's a service provider, maybe outreach and connection from them to let them know about this possibility of connecting with a resource. Folks are there that want to do the service, right? But sometimes we just don't know where folks are located and how we can best be connected to them. And then also provide a little grace too, because we may not all have the resources to be able to do all of it. So just understand that that's part of that connection as well.
Yeah, definitely.
Emily, can you ask that one more time? I'm sorry.
Yeah. Are there certain populations that are not being connected with the resources available to them? And what can we do on the front lines to make sure those people are being connected?
I would say definitely. On our end, a lot of our immigrant populations, I have found, or we've seen in our agency, when we have staff that either speak the language or have a connection to different communities, we see an increase in individuals from those communities reaching out for supportive services. And so we do a lot of work trying to be in our communities, in the spaces, trying to identify those marginalized, groups. Where are the groups, where are the individuals who are LGBTQIA, plus identified, where are the clubs? Where do people gather? We want to make sure that the information is in those spaces, that we have our information is translated in the various languages so that we eliminate those barriers and we are accessible. We are able to be approached by them and get the support. Has been key for us. Where do people go? Wherever people go is where we try to have stuff. It's the bars, the tattoo shops, the churches, and then we adapt our information for those spaces and do a lot of education so that, people working with domestic violence is one of those things of you don't really want to have to talk about it or deal with it until you need it. And then when you need it, you don't know where the stuff exists at. And so we try to do a lot on the front end to make sure it's visible. And if you need us, we can get to you.
Yeah, absolutely.
I was going to add too, if it's frontline staff, and how do you get the person you're working with that's experiencing homelessness connected to the right group that can help? I think it's really important that we talk about coordinated entry again. And if there are frontline workers out there who are not familiar with coordinated entry, I would encourage them to kind of reach out and kind of figure out what that is. Every community in the state, every county in the state of Iowa has coordinated entry. And so that way, if there is maybe a domestic violence agency that identifies a veteran, maybe it makes more sense to them to get VA services over domestic violence or whatever. I mean, I think having those types of, it's a way for people to to get identified as a veteran going through coordinated entry, and then the VA can assist, or the SSVF grantees.
Yeah,
I would echo that. Coordinated entry has been, it really has been wonderful for us in Johnson, Washington. We participate in 3 different regions. But even being able to come together with those other homeless service providers and, looking at the list, because we use a VI SPDAT to be able to prioritize who has the greatest need. And there are times where we may not have the resource, but we're the service provider for that particular, group. Domestic violence victim survivors, but we're able to go to those coordinated entry meetings and then advocate. And so another program might provide the rental assistance or the security deposit, and then we provide the case management because that's where our expertise is at. And we use all of our resources to make sure that those that have the greatest needs, are met to the best of our ability. That's been a huge, huge benefit for DVIP.
Thank you. And sorry about that. I think we've been all talking about meeting people where they're at, right? Because everybody needs to have a little bit of service, a little bit different. We're not alike. And so our needs are not going to be all exactly alike. And then just that need for collaboration among organizations, entities, communities. That's so, so important, because we know we don't have the resources we need. And so we need to be really effective with the ones that we have. And those are the ways to do it.
Yeah, I think also too is knowing the resources, and as a viewer that could be very overwhelming to hear some unfamiliar terms, but kind of like we all know to call 911. I think there's more awareness out there now that if you need a resource, call 211. That can really be your first stop, and it can help guide you to where you could go to in the community, or who to call, whether it's primary health care or YSS, and kind of triage it for you. Whether it's a food bank that you're interested in, or rental assistance, or all those kinds of things. Those are really important. And if people have the desire to want to get involved too, you could reach out to any of our local organizations as well. A lot of times we're doing things, or really looking for community partners to do things like pillow drives or toilet paper drives or anything like that, making some kits that we can hand out when we do find people doing street outreach. There's always a way to get involved, and every amount of help is welcome and encouraged.
Yeah, thank you. One more question I wanted to ask from all of you, because I think one of the things that all of the different populations you work with have in common is that they all, besides that they've all ended up in homelessness, a lot of them got there because of traumatic situations, difficulties that most people aren't going to face in their life. So how do you ensure that the care that you're providing is trauma informed, making sure that people have that we have the sensitivity when approaching these people who need our services?
At the VA level, majority of our clinical staff are licensed social workers. Most of us have our master's degrees. So, the VA really looks at that education piece of staff. And then we get lots of training through the balance of state. There's also training in regards to trauma-informed care.
Absolutely. What does that care kind of look like when it comes to approaching someone for the first time, or when someone first seeks services?
So I think it's a balance of safety of the participant or the person we're coming up to, and safety of staff. And so there's a large training component, being kind, realizing they might have a lot of things going on we have no idea about. So sometimes we might have to back away, or, for 3 months, just offer them, hey, do you need some fresh bottled water? And that could be the start of a positive relationship of building that trust. But I think a lot of times it's a lot of really individualized skill building and really kindness and knowing that everybody else has things going on and we don't want to cause them any more trauma than they've already been through.
I think it looks like a lot of different things. It's having the trained staff, right? It is having thinking about positive youth development. What does that look like in the different things? So there's a lot of different training things from that perspective. It's having pictures in your, if you have pictures in your entry area, have them look like the people you're serving, right? Have it be diverse from that perspective. It's there definitely is that training component. It's that respect. There's a lot of specific criteria that can be outlined, and I'm not the professional to be able to do that from that perspective. But I can share with us as we work with our continuum of care, our resources. We put out expectations or standards for our service providers that are funded, that there is training for trauma-informed care, for youth, positive youth development, for different things along that line. And now we are looking as an organization, and we also partner with continuums of care across the state to provide more of that training. And what does that look like? And what can we do? Because we've had a lot of turnover in staff since the pandemic. And so we just really need to make sure that we're continuing to train and provide those resources, as well as acknowledge that there are some small service providers out there that maybe don't have the resources to bring in all this training. So what can we do to support that work as a community, as partners in the state, so that we know that folks have all the tools that they possibly can to best serve folks and, as Hope said, not cause further trauma in their lives.
I would echo what the others have said. We go through extensive trauma-informed care training. Also, our services are victim-centered in the sense of we don't mandate anything. And so we work really hard to meet a survivor where they are and allow them to kind of guide the services that they receive, whether they interact with us one time or they interact with us over, a longer period of time. We really take their tempo and we don't want to re-victimize. So we try to eliminate them having to tell their story multiple times, but really being able to kind of hone in on what they're seeking services for, what it is that they feel like they need, what they would like the outcome to be, and then having realistic expectations of what we do and how we can support them in their journey, but that they're the ones in the driver's seat. So no interaction with us is something that's mandated. So those are the ways in which we really try to reduce any re-victimization or harm by engaging with us. And one of the things that Angie highlighted, even just our space, the diversity and inclusion, and how, we advertise any interaction or coming into any of our facilities, having some type of representation so that you could see yourself there to try to eliminate a barrier and know that it's inclusive for you is important too.
We have a local service provider that says clear is kind. Try to be as clear as possible, and understanding that, people are in a crisis situation. So you might have to be clear multiple times, right? Just because you say it once doesn't mean it will stick with that person, right? And so just thinking about those different things, but clear is kind. I think that's a good process to think.
Yeah, definitely. Thank you. We've got a few questions related to the Unite Us system. That's not one that I'm super familiar with, but I don't know if that's something that you guys have worked with. This person says, how can we help agencies helping those in need get on board to the already existing Unite Us that 211 is linked with? This ensures continued care that spans beyond any one sector and ensures person-centered care. Is that a system that you guys have worked with?
I'm not aware of it.
I have not.
Okay, then we'll jump over that, but
Well, then we all probably need to learn what the United System is.
yes, there we go.
Is that 2 words or one? Is it
Unite us, 2 words.
Or unite us.
us? Okay.
Yes, there you go. Something helpful maybe from one of our viewers today. What are some of the systems that have changed over time with the people that you work with and with legislation and just the systems built into place in Iowa that are there systems that have changed that have improved things and things that maybe have gotten worse in the past few years from changes made that are outside of the control of those doing this work?
I'll go back to, I think, housing first. That's been a system change that has been focused on, it's evidence-based practice for 20 or 30 years, right? But it really was a focus, I think, from a federal perspective coming up. And heard a presentation this morning that talked about the fact that this person had worked prior housing first to post in permanent supportive housing. And before that, the success rate was about 82%, which is really great. But once they implemented housing first and that evidence-based practice and what it is, they now are successfully housing 96% and in that permanent supportive housing, keeping them housed. So like that's an important change that I think has made a definite impact for permanent supportive housing and supportive services together.
Yeah, definitely.
I was just go ahead.
Yeah, I think we're moving in a really positive direction, being more client-centered, positive youth development. Since even I've come in, it's become less about power struggles, saying you need to do this and this and this to get this, and more about engaging them and teaching them and working alongside them. There's nothing quite as demoralizing as saying, for you to keep your home, you have to do this list of 10 things, improve your sobriety and all of barriers. When I think as a state and as providers have really embraced the model of saying every person deserves a home. It doesn't matter. And we want to have as few barriers for each individual as possible, because no matter your circumstance, you deserve a home.
Yeah, thank you.
I was just going to share one of the things that the VA has definitely been working on is recognizing, okay, homelessness doesn't live in a silo. And so there's definitely been a lot of coordination and collaboration with other fields, medical fields. I know Central Iowa VA, they have an occupational therapist on their team to help assess if veterans can live independently. Here in Iowa City, we've recently hired a position that's a geriatric social worker for our HUD-VASH team. So really trying to look at where the needs are and then how can we get those needs met within our medical system.
Yeah, thank you.
I would say one of the significant changes that we went through in providing DV services was about 7 years ago. We went through regionalized services. We had probably about a $1.2 million funding cut on a state level. And so our agency became the service provider. We were originally providing services for 4 counties, and then we took over an additional 4. And so the learning curve of learning those communities and getting access to the places where people are to be served has had some challenges. I think we're doing really well now. Another thing that we haven't talked about, but also plays a part in service provision, is staffing. We experience a lot of challenges with filling key positions in our communities, and the recruitment of staff who are qualified that can be trained, and then staff retention, which goes back to something that Angie was saying, the competition of livable wage, the people who are on the front line doing the work, providing the services, being able to survive themselves.
Yeah.
So
it's not helpful if the people providing services for those experiencing homelessness are about to be homeless themselves, can barely afford rent.
Yeah.
That actually leads into, and I just got our 5-minute warning, so this may be our last question, but I like this question that was just sent in that relates directly to what you were saying. It says, someone mentioned high turnover in organizations that serve unsheltered individuals. How does this impact the individuals served, and what can we do to decrease that turnover rate?
Well, it significantly impacts the individuals who are served. When we were talking about that trauma-informed care and trying to minimize harm and reduce re-victimization, it's hard when you reach out to an organization and you don't know who is going to be the one providing services, or the turnover in staff. Serving 8 counties, and we hire people who come from the communities, you build up trust, you build up connection, and it's through that individual who's providing services that really brands and gives a face to the organization and builds up trust if they do well or not. So I would say it plays a huge impact on service delivery. And then when you have gaps and you have staff turnover or openings, it reduces the amount of people you can serve and the quality of services. So that's significant. You retain it, I feel like, by taking care of your staff and the resources to, pay them well for the hard work that they're doing.
Yeah, definitely.
I agree with all of that. And I'd also say, make sure they have the training that they can successfully do the job, right? Make sure that we understand that there are needs, and it's hard work. And so we need to take care of our staff from a mental health and support perspective. So that is, I think, a very important thing. And just, in general, so a little bit different, but we have to look at our systems. What are our systems doing? And are they creating some of our problems that are really causing us to increase issues with homelessness? What are we doing from that level? Because if we could prevent and invest in prevention, and I would say, I would guess, invest in prevention in domestic violence, invest in prevention in a myriad of ways that we could prevent people from becoming homeless, that would make a large impact for us as well.
Yeah, definitely. Thank you. All right, I think we're just about out of time. If anyone does anyone have any just closing thoughts, or kind of what you would hope that our audience members are able to walk away with from this discussion?
One, I would say, don't be daunted. It's a lot of work, right? But we know we can make a difference when you have the appropriate level of resources. I'll just keep saying that because it's truly true. And that we need you to be involved as a community. That's important if we want to make a difference. And, reach out to your elected officials. If you think something needs to happen in your community, do those things. It's important. We're not going to do this all by ourselves. We need everyone to make a difference. And so that's my wrap up.
Yeah.
Absolutely. Couldn't have said it better.
All right.
Yeah, I think all of us are, all of our organizations are on social media. So it could be something as little as just following us and then sharing the information we provide too. We will assist with the education. If you could help us share the word, we would love that and appreciate it so much.
Absolutely.
And if you're connected or in close proximity, find ways to volunteer. There's a way to support the work.
Definitely. Awesome. Well, thank you guys so much. I really appreciate you being here. Thank you to our panelists, and thank you to our audience members for tuning in. I apologize if you asked a question and I wasn't able to get through it. There was a great discussion going on and we had a lot to cover. I think we could probably talk for several more hours if we had the time. So thank you everyone for tuning in, And be sure to tune in for the rest of the week at noon every day. There's additional sessions covering various topics related to homelessness in Iowa. So don't miss out on those. Thanks, everybody.
Thanks all.